Indications for platelet transfusion in dengue. Platelet transfusion in dengue should not be a routine measure. It should be given only if absolutely indicated. The most absolute indication is that suppose a patient has bleeding. So patient presenting with bleeding manifestations and platelets of less than 50,000 per millimeter cube, then it is an absolute indication to give platelet transfusion. So active bleeding could be either mucosal bleeds, skin bleeds, internal hemorrhage like GI bleed, intracranial hemorrhage, etc. Transfuse with platelets less than 50,000 with bleeding. And suppose there is severe bleeding, regardless of platelet count, you should give platelet transfusion like profuse GI bleeding, hematuria, post-procedure bleeding, intracranial hemorrhage. If such type of thing is there, you have to give, irrespective of platelet count, you have to give platelet transfusion. Prophylactic platelet transfusion is only for selective uses. It has to be only given if the platelet count is less than 10,000. So more than 10,000, usually it is not required. And that too, it often said that suppose platelet count is less than 10,000 also, only in high-risk patients who are more prone to bleeding, like elderly patients, patient who are having multiple comorbidities, patient is planning for any invasive procedure, then only you give transfusion. Otherwise, routinely platelet transfusion, even for less than 10,000, is not recommended as such. So for invasive procedures, for any other procedure, the platelet count should be at least maintained more than 50,000 for any procedure. And suppose neurological procedure patient is going to undergo, then it should be maintained up to 1 lakh. So not recommended routine prophylactic platelet transfusion in stable patients without bleeding. Even if patients with less than 20,000, it is not recommended. Study have shown no benefit, and there are risks include with what are the risks? There can be fluid overload. There could be alloimmunization. That means the transfusion reaction because of the platelets. Worsening of the capillary leak. Capillary leak can get more worsen because of this. So this is a problem. You should not routinely give platelet transfusion because patient can have worsen outcomes with this. So key points summary is that platelet transfusion should never be based on count alone. Always assess clinical signs of bleeding. Fresh blood or packed cells plus platelets may be needed if bleeding is significant. Dengue-related thrombocytopenia is often self-limiting and does not always require corrections unless bleeding is evident.